Okay friends, today we are discussing about aneurysm. Okay, aneurysm. So what do you mean by aneurysm? So we are discussing aneurysm in these headings: definition, types, and some classifications of aneurysm. So first we are coming to definitions. So what is the definition of aneurysm? So there are many definitions, but in standard books there will be a definition, so we have to follow that. It is a permanent localized dilatation of an arterial system. What is it? A permanent localized dilatation of an arterial system. So this is a localized dilatation of arterial system. So if it is a localized dilatation, so we can call it as aneurysm. So what is the amount of circumference that we can call as aneurysm is? There will be two types of localized dilatation. It is at specific anatomical level we are discussing. So this is heart. So from this we are getting aorta like this. This is a rough diagram. Please bear with me. So this is diaphragm and this is abdominal aorta. So we are discussing at this level, at this particular level, if the dilatation is more than or equal to 50%, then we can call it as aneurysm. So if it is less than 50% of the normal, so it is more than 50% of the normal diameter at this particular anatomical level, so we are calling it as aneurysm. If it is less than 50%, we are calling it as ectatic. So this is the definition. So we are then coming to types. So when we are coming to types, means there are different types of aneurysm based on the various themes. Okay, aneurysms are divided based upon the etiology of aneurysm. First one, etiology. So in etiology we are getting atheromatous aneurysms. So atheromatous means nothing but degenerative aneurysms. This is the first point, first etiology. Second one is connective tissue disorders. Connective tissue disorders or collagen diseases. Next, infective aneurysms. So we have known that mycotic aneurysm is come under this infective. Mycotic means it is not caused by fungus, it is only caused by bacteria. Usually the tertiary syphilis causes obliterative endarteritis of an aneurysm. Obliterative endarteritis of the vessels in the wall of the aorta. So we have many walls such as intima, media, adventitia. So in this media we have supplying vasorum. This is the supply for these supply blood for aorta. So and there also we have vasa nervosum. They supply for, this is the nerve supply for aorta, aortic wall. So these are present within the tunica media. So this tertiary syphilis will cause obliterative endarteritis of the vasa vasorum, causing a localized dilatation. Next, traumatic aneurysms and arteritis. Nothing but these are vasculitic aneurysms. Okay, vasculitic aneurysms. So these are the 5 main etiology of aneurysms. Then again aneurysms are divided based upon etiology, one classification, and another one is based upon the wall. Based on wall of aneurysm, we have true aneurysms and false aneurysms, nothing but pseudo aneurysms. Okay, pseudo aneurysms. In true aneurysms, we can know that all 3 layers are involved. So that means intima, media and adventitia are all involved. In pseudo or false aneurysm, not all 3 layers are involved. Usually the intima layer will be involved. Okay, something I am showing a schematic diagram. So these are the walls of aneurysm, 3 layers. So here we are getting aneurysm like this. 3 walls are localized dilatation. This is aneurysm. So from the definition we know that aneurysm in these anatomical levels, more than 50% of its normal diameter at its anatomical level. It's called aneurysm definition. And this is a schematic diagram for pseudoaneurysm. So these are the 3 layers: intima, media, adventitia. So here the layers of aneurysm is not covered by all layers. So like this, the intima only protrude through these layers. So this is pseudoaneurysm. So this is one type of classification. In this true aneurysm, we are getting based upon the morphology we are dividing. Okay, based on morphology of aneurysm, we are dividing the true aneurysms into fusiform aneurysms and saccular aneurysms. This fusiform means the shape. So true aneurysms are again divided into based upon the shape of aneurysm, nothing but morphology. This is fusiform. Okay, saccular means saccular are again divided into concentric saccular and eccentric saccular. Concentric and eccentric saccular aneurysms. So concentric means it's like a sac, it's not similar to fusiform. So I can draw another neat diagram for this, so you are not confused. So this is how the fusiform aneurysm will look like. This is sac. Saccular means like sac. So this is concentric sac. That means both side dilatation. Eccentric means only a single side saccular dilatation. So we have to remember this fusiform and saccular based upon the morphology of true aneurysms. So what is the importance to divide this concentric and eccentric means? So here these eccentric aneurysms have increased risk of rupture. Rupture risk is increased for this. And we further classes we can discuss based upon the size of aneurysm, there is a risk of rupture is increases, but in eccentric saccular aneurysms there is no such size criteria for the risk of rupture. Okay, so this is based upon etiology, based on the wall. There is true and false aneurysms, and true aneurysms again divided upon the shape, fusiform and saccular aneurysm. Saccular again divided into concentric and eccentric. Next, another type of classification of aneurysm is third one based upon. So this is the third one, and we are discussing the fourth one. This is based on location of aneurysm. Based on the location of aneurysm, we are dividing the aneurysm into. So we know that from heart, which is located in the thorax, this is heart. So from these we are getting the arch of aorta, aneurysm. This is a diaphragm. So there is ascending aorta, arch of aorta, and descending thoracic aorta, and abdominal aorta. So there are various types of aneurysms based upon the location. So we can get ascending aortic aneurysms, arch of aorta aneurysms, and descending thoracic aortic aneurysms. So it is also called as thoracic aortic aneurysm usually, and we can also get abdominal aortic aneurysms, and there is a fusion of these two also. This is called as thoraco-abdominal aortic aneurysms. So you have 5 types of aneurysm based upon the location. I think you get it. And fifth type of classification is based upon the presentation of aneurysms. So aneurysms can present in acute state or chronic state. Acute means nothing but rupture of aneurysms. Okay. This chronic means there may be symptomatic aneurysms and asymptomatic aneurysms. So symptomatic is again divided into uncomplicated aneurysms and complicated aneurysms. Okay. So complications, what are the complications you get? So all the complicated symptomatic aneurysms will go under acute presentation. So we can get fistula, embolisms, and rupture. So this is how the presentation of aneurysms is divided based upon the presentation. So overall, see, we have etiology, we have based upon the wall, based on morphology, based on location, based on presentation. I think you get it. So we are moving further for classification of aneurysm. So in the classifications of aneurysm, based upon the extent, we are dividing it. So we are mainly discussing about these 2 types of aneurysm. So thoracic aortic aneurysm and thoraco-abdominal aortic aneurysm. So for this you have to remember some levels. So I am drawing this, bear with me. This is another level, this is another level. So this is the level where it is distal to left subclavian artery, and this is 6th intercostal space. This is 12th intercostal space level, nothing but diaphragmatic level, and this is renal bifurcation level, and another level is we have aortic bifurcation level. So as we know, this is how ascending aorta, arch of aorta, and descending aorta, this is diaphragm. So like this we know that. So from this is again divided into like this. So this is left subclavian artery. So we are discussing about the levels of aneurysm based upon the extent of dilation. So we are discussing about thoracic aortic aneurysm and thoraco-abdominal aortic aneurysms. So for thoracic aortic abdominal aortic aneurysms and thoracic aortic aneurysms, so this TAA classification is Crawford's classification for thoracic abdominal aortic aneurysm. So thoracic abdominal aortic aneurysms. So these are divided into 1, 2, 3, 4 and 5 classifications, and this is thoracic aortic aneurysms. This is for thoracic aortic aneurysms. Classification name is S strata. So we are having divided into ABC types. Okay, these are important for neet-pg entrance and SS entrance also, so please friends remember it. So here we are discussing the levels, extension of these aneurysms. So distal to left subclavian artery and 6th intercostal space, 12th intercostal space, renal bifurcation, aortic bifurcation. So this renal bifurcation occurs at the level of L2. This occurs at the level of L4, aortic bifurcation. So I am marking the Crawford classification with blue color. So please remember. So Crawford classification for thoracic abdominal aortic aneurysms. These are divided with 1, 2, 3, 4, 5. Again. So I am drawing. So first I am telling in a easy way of remembrance. So they extend from here, entire here to, so this is renal bifurcation and this is aortic bifurcation. Okay, this is how we are dividing. So this from here and here entire length is dilated. This is belongs to type 2. Okay, this is type 2. Next, go down one level for up to 4th level. So this is type 3 and this is type 4. Okay, so 2, 3, 4, and when it come to 1 and 5, the dilatation is only above the level of renal bifurcation. So it is like this. So this is 1 and this is 2, 4, 5, 5. This is how you can easily remember based upon the simple line diagrams. And for thoracic aortic aneurysms I am drawing in orange color, so please remember. So from this, so thoracic aortic aneurysm means, so we are getting from distal aorta to 12th thoracic, 12th intercostal space. So this is C, this is B, and this is A. Okay, so please remember friends. And again, so these are for TAA and TAA. Okay, they are also for abdominal aortic aneurysm. So we have told that. So we are discussing about this, and so we are discussing from this. Okay, this abdominal aortic aneurysms are again divided into infrarenal, juxtarenal or pararenal, and suprarenal. Okay, so you can, from the name we can get that this is infrarenal, means this is renal vessels, renal bifurcation. So below this we have dilatation, and this is aortic bifurcation. So this is infrarenal aneurysms. Juxtarenal, so this is juxtarenal, so close to renal bifurcation. So this is juxtarenal. Suprarenal, from the name we can get in that. This is how suprarenal will be present. Okay, so out of these abdominal aortic aneurysms, these two is juxta and supra are common in females. Okay, and the most common aorta type of aneurysm is infrarenal type of abdominal aortic aneurysm is 90% common, whereas the incidence of this is 8%, whereas the incidence of this is only a 2%. Okay, and here's one important line I'm discussing. Most common location and type of aneurysm overall. So it is infrarenal abdominal aortic aneurysm of fusiform type. Okay,